Okay, so one of the really good tests for me in terms of assessment, in terms of a safe return to play, is looking at the drop lunge. So if we're thinking about that kind of reverse lunge action, we're going to take that injured leg into hip extension. We're going to take it into knee flexion action as well. There's a big eccentric component to that. And again, thinking back to what we've just discussed in terms of, is this test relevant and appropriate? For me, this drop lunge is one of the real good tests that we can look to do. And there's a bit of a continuum in terms of the way I think of it, in terms of kind of getting them back to jogging, getting them back to kicking, getting them back to high speed running and sprinting. The test can be really progressed and it allows us to have confidence as we're moving through each stage. So what I'd like you to do, Jack, to start with is just do a reverse lunge. So if your right leg goes backwards, so again, if we're thinking about that action and where they finish up, thinking back to on the bed in terms of that Thomas test, they go into that hip extension, knee flexion position with a nice high hip and knee on the opposite side, thinking about that running gait pattern. So this is just a really easy start into it. Are they feeling any symptoms? Are they feeling any kind of apprehension? And that probably is going to be the biggest thing in terms of going back through, thinking some of the hamstring data that's out there in literature around kind of patient happiness and apprehension to perform sprints and high speeds. For me, this comes into this test. Are they happy and willing to perform this test as we go through it? Because physically we'll probably have exposed them to similar sort of things within rehab, but this is a really nice return to play marker. So what I'd like you to do to progress that now is to start in that position, jump upwards as high as you can, and then land in that drop lunge position. So that back leg's going to be nice and long, nice and extended. So in your own time, if you jump up and then split the legs. Perfect. So if you just perform that a couple of times for me. Again, so we're wanting to cue if you can keep that chest nice and tall. Good, we're thinking about what's the hip doing. We don't want them coming into too much flexion and they're actually offloading that proximal aspect to the rec fem, which is what we want to test. Good, and relax for me. So thinking about what they're doing, how they're doing it, can we get that hip as long as possible and can we get that chest nice and tall? So that's the first stage. And I'd be pretty comfortable if someone could kind of perform that 5 or 6 times, no apprehension, be comfortable that they're appropriate to go back outside in terms of some sort of jogging action. We're not exposing the hip to too much speed. The way that hip flexor, knee extensor is going to be working, nice and easy, low level, but we know that they can absorb some load into that.